my name is Alexia Slaughter. I'm going to be doing the week 4 assignment. So, beginning with the scenario is that the emergency medical services team has brought in a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the person is found wandering in a nearby park by a jogger, who called 911 from her cell phone after the woman screamed obscenities at her and fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell the stale body odor and urine. So, from fully understanding this, she's probably suffering from a mental health crisis. There also could be drugs involved, depending on the crisis that she is experiencing and why the crisis has begun. Short-term effects from a mental health problem can just be alienating from peers, being perceived as unattractive due to her lack of showering and her lack of ability to take care of herself. It may also have anger, fear, disorientation, depending what kind of mental health issue she is having, which we won't fully understand until we fully diagnose the patient. She might have hallucinations or feel as if the world is against her. So as a nurse, we need to understand that the patient isn't their normal self right now. So the fact that they are so angry is probably not their normal patient experience. If this continues to happen, the patient may get into drugs. She may unfortunately commit suicide. Her body will begin to shut down because of her lack of ability to feed herself and shower and drink water, or even just she could get in danger because in this experience she was out in public having a mental health crisis. So luckily enough, someone called EMS, but if no one had, she could have continued to wander with those scrapes and bruises that we don't know how bad they are. Some other long-term effects can just, like I said, fully depend on what is being abused or if there is a drug abuse. But if there's drug abuse, she's going to go through withdrawals. She's going to go through a possible dirty needle. The patient is just not going to be fully aware of what is happening, which really can damage her body and mind. So some options for her is we will definitely would like a psych consult so we can figure out if she has prior been diagnosed with any sort of mental health crisis or if this is her first one. We'll also probably like to do a talk screen to understand if there's any sort of drug abuse that is happening, and if so, we will need to be prepared for the withdrawals. I think that is probably why the patient's hands are shaking and could cause a lot of her confusion and combativeness. I know not all people with mental health issues abuse drugs, but the current signs of the needing a bottle and shouting and screaming probably means that she has been abusing drugs. The shaking is probably due to how long it has been since she's had the drug. She could either be peaking on the drug or going through withdrawals. Her confusion and combativeness goes along really well with most mental health issues, as she isn't in her right mind currently. And a lot of times, like especially with schizophrenics, they'll have someone in their mind telling them that someone is, or they'll have a voice in their mind telling them that there's someone attacking them. And so the fact that the nurses and doctors are hovering over her, she probably thinks that they're trying to damage or hurt her. Again, we'll definitely need to identify the patient's mental disorder to fully be able to treat her. A lot of this sounds like drug abuse, maybe mixed with schizophrenia. And if this is her first breakdown, we will need to make sure that she is being properly medicated and probably properly watched once we have discharged her. So she may have to go into a full-term mental health facility if she does not have family members that are able to take care of her. All of this information I received from, the Psych Guides from their mental health problems, symptoms, and causes and effects. Question is mental health illness management includes both pharmacological and therapeutic methods for treatment. Summarize how this is managed and if there is any support of insurance. Is it sufficient and how would you make it better? Beginning with how treatment is managed, usually if someone is going through a mental health crisis, we'll put them on antidepressants and some antipsychotics, but therapy is one of the largest parts of recovery. They will need to identify if it is a long-term crisis or if it is something that can be fixed with therapy, such as like a depressive episode or even a PTSD episode. Those can both be helped with therapeutic methods. If it's something like schizophrenia, they will probably have to be on medication for the rest of their lives, but it can be easily maintained and managed. Insurance, in some cases, are very helpful with mental health crises, but because mental health does not show with physical scans of an x-ray and things like that, oftentimes insurances believe that they are not needed, and sometimes therapy in general can be completely out of pocket, and most patients cannot afford that. So before offering therapy and things like that, we must know their insurance and what kind of stuff it covers so that we are making sure that this patient will get the best long-term care. Unite for Sight, it lists ways that we can make mental health care more accessible, because oftentimes people aren't aware that mental health care is an option until they are going through a mental health crisis. There's also a very large stigma on mental health. So one way to understand this is to build a community of mental health services. Build a community that uplifts people with mental health issues so that once they go through an issue like this, they're not afraid to get help. Another way is to integrate mental health services into primary health care. So I know that personally, my doctor, that when I go in every single time, if I'm even in for a cold, they ask about my mental health. And this opens an open communication where patients can really divulge if they are feeling as if they are going through a mental health crisis. It's also really important to promote self-care so that these patients, again, feel more comfortable if they feel something is wrong, that they are able to go to a professional. To Healthline, most insurance companies do cover some form of therapy. Oftentimes, the insurance company will not provide therapy if there's been no diagnosis of mental health, which I personally feel as if can really change, where we open a thing where people go to therapy to determine, even if they don't have an actual mental health disorder, we just create this environment where people are open and comfortable in speaking on their mental health. This is all I have to say about the topic, and I really find that mental health is important and must be taken away from a stigma, away from it being gross and obscene and something that we don't want to see, because it is real, and most people will have a mental health crisis at least once in their lives, even if it's just dealing with grief or bad news and it's not a lifetime struggle they have to deal with.